Hi, welcome to Professional Certifications channel. Let's break down NCLEX exam preparation, one topic a day for focused and effective learning. Today's topic is EKG/ECG interpretation.
EKG Basics. An EKG records the heart's electrical activity. Here's what you're seeing. P wave, atrial depolarization, contraction. QRS complex, ventricular depolarization. T wave, ventricular repolarization, recovery. Key intervals. PR interval, 0.12 to 0.20 seconds, AV node delay. QRS duration, less than 0.12 seconds, normal conduction. QT interval varies with heart rate.
Step-by-step EKG analysis. 1. Rate. Regular rhythm. Count the number of big boxes between two consecutive R waves. Divide 300 by the number of big boxes. Irregular rhythm. Count the number of QRS complexes, the spikes on the EKG representing ventricular depolarization, within a 6-second interval. Multiply that number by 10 to get the heart rate in beats per minute, BPM. Example. 3 big boxes equals 100 BPM. If there are 7 QRS complexes in a 6-second interval, the heart rate would be approximately 70 BPM. 7 times 10 equals 70 BPM. 2. Rhythm. Regular versus irregular. Use calipers or paper trick. P waves present. If P waves are absent, it may indicate atrial fibrillation, AFib, where atrial contractions are disorganized. 3. Axis, normal axis. A normal axis is indicated when the QRS complex is positive in both leads I and AVF. Left axis deviation. Left axis deviation can be seen in conditions like left ventricular hypertrophy, LVH, and left bundle branch block, LBBB. Right axis deviation, right ventricular hypertrophy, RVH, and pulmonary embolism, PE, can cause right axis deviation on an EKG. 4. Intervals. PR prolonged, greater than 0.20 seconds. First degree, AV block. Wide QRS, greater than 0.12 seconds. Bundle branch block, VT. Long QT, greater than 0.45 seconds. Risk of torsades. 5. ST segment and amp, T waves. ST elevation. STEMI, EG, greater than 1 mm in 2 plus contiguous leads. ST depression, ischemia. Peaked T waves, hyperkalemia.
Critical rhythms. Ventricular fibrillation, VFIB. If the rhythm is chaotic with no pulse, immediately defibrillate to attempt to restore normal heart rhythm. Ventricular tachycardia, VTach. Wide QRS, no P waves, shock, defibrillation is required immediately. Third degree AV block. P waves and QRS dissociated T suggests a third degree complete heart block, and a pacemaker may be needed.
Clinical cases. Case 1, chest pain. ST elevation in leads V1 to V4 indicates an anterior STEMI, street elevation myocardial infarction. Immediate transfer to the cath lab is required for intervention. Case 2, syncope. Bradycardia with dropped QRS complexes suggests a second-degree AV block, where some atrial impulses are not conducted to the ventricles.
Pro tips for nurses. Always compare old EKGs. Is this new? Look at all 12 leads. Posterior MI. Check V7, V9. Treat the patient, not just the EKG. Hypotensive? Act fast.
Conclusion. EKGs seem complex, but with this system, you'll catch deadly rhythms every time. What's the toughest EKG you've seen? Drop it below. Like/subscribe for more clinical skills.